Hello friends, in this video we will talk about the cost of robotic surgery. So, as we all know, robotic surgery for treating hernias and many other conditions is coming up in a big way, and it is the most preferred procedure for treating complex abdominal hernias. But is this affordable to the common man? Many patients ask us, sir, we want robotic, but I am worried that it may be very expensive and unaffordable. Can I get a robotic surgery done? Before knowing the cost, let us first understand why is this surgery more expensive than a regular laparoscopic operation. Both these surgeries are done through small holes, both are minimally invasive operations, but why is there an extra cost involved when you do the same operation by a robot? The first thing is the equipment cost. Robot is a very expensive piece of equipment and the investment cost for the hospital is high. The second most important reason for the added cost in a robot is the cost of the robotic instruments. These are limited use instruments, meaning when you open a new instrument for a robotic operation, it will work only for 10 surgeries. After that, the software will shut down the instrument. Even though the instrument might be good, after 10 uses it stops working. So, why is this done? This is to improve or enhance the safety of the operation. So, there is no way that the instrument gets used beyond its recommended time, and that can compromise on the safety of the operation. So, once an instrument is opened, you can only do 10 operations, and after that the instrument has to be discarded. The same is not true for an laparoscopic or an open operation, where an instrument can be used much beyond its recommended lifetime also, and this can sometimes be dangerous to the patient. So, how much is the extra cost incurred when somebody opts for a robotic surgery instead of a laparoscopy? The usual cost is around 40 to 50,000 rupees extra, which is used for these disposable instruments, is the charge the patient has to bear. So, is it worth to spend so much money on a robotic operation when one can get it done laparoscopically? Yes. Why? By doing a robotic procedure, a surgeon is able to handle more and more complex hernias by robotic. These hernias may not be handleable by a laparoscopic procedures because they are very complex. So, the surgeon might opt to go for an open operation. So, a patient who would otherwise end up getting an open operation with a long incision is being managed by minimally invasive option because a robot is available. So, spending that extra money and then avoiding an open surgery, getting back to normalcy very soon, getting back to productive life much faster, 10 times faster than an open operation. When you compare these advantages, it is always worthwhile to spend that extra money when you can have an option of getting a robotic hernia repair done. Also, these days more and more insurance companies are reimbursing the robotic cost. So, the awareness has spread and many of the patients get their insurance coverage for robotic procedures these days. So, when you look at the overall advantages of robotic, the extra cost which you incur for a robotic procedure is very justified.